Late. So good evening and welcome to the Diversity in Medicine webinar series hosted by the Associated Medical Schools of New York. My name is Jenny Tassler. I'm the Director of Government Relations and External Affairs here at Ames NY, and I'm joined by Nyla Lindo. Our guest tonight is Dr. Raja Flores. Dr. Flores is currently the chairman of the Department of Thoracic Surgery and a professor in thoracic surgery at the Mount Sinai Medical Center. Dr. Flores attended the Albert Einstein College of Medicine and completed his residency in general surgery at Columbia Presbyterian Medical Center. He then completed his thoracic oncology clinical research fellowship at Brigham and Women's Hospital, Dana-Farber up in Boston, but we won't hold that against him, and a cardiothoracic surgery residency at Brigham and Women's. Dr. Flores is a leader in the field of thoracic surgery for his treatments of mesothelioma, and tonight he's here to discuss his career as a thoracic surgeon and talk to you all. So welcome, Dr. Flores. Thank you so much for joining us tonight.
Thanks for having me.
Just as a housekeeping note, I'll say that we do try to facilitate an open and engaging discussion. Sometimes the Zoom can get large, so we have everybody on mute for right now. If you are interested in asking a question, and we certainly encourage that, please just use the raise the hand feature or put a question in the chat and we can make sure that Dr. Flores gets it. All right. So Dr. Flores, let's start out with you telling us a little bit about yourself and your career and your path to thoracic surgery.
So basically, I was born and raised here in New York City. I grew up with a single mom. We were poor. My mom worked as a secretary. My dad left when I was 6 years old. We're still friends, but you know, there's a love-hate thing going on there. And so my mom really basically worked and to try and support me and to put me through school. I worked since the age of 9. I worked in a factory. I worked in a deli making sandwiches. I loaded trucks for UPS. I did a lot of non-medical work. And it made me realize at a young age that, man, I don't want to do this. It was interesting. So I'm working for UPS on 43rd Street and 10th Avenue. And I'm on the sorting machine, loading, taking boxes. And you know, the guys in the union are there, old guys that have been there for years. Hey, yo, Flores, you in the union, why are you going to school? You know, they're like, you got benefits, you got this or that. And, you know, God bless them. That's a good job. They're taking care of their families. But I just said to myself, man, I don't want to be loading trucks for the rest of my life. And that sort of made me want to stay in school because I realized once you left school, you got to work. And work is for the rest of your life. So stay in school as long as you want. You know, it's great. You got young people all around you. You got your friends, you know, you don't really have much in the way of responsibility. So don't think of it from a time thing. I got to finish here so I can do this. Just enjoy it along the way. And so that made me decide to stay in school. Now, I was lucky enough every step of the way. I had either a scholarship or financial aid. There's no way I could have done this alone. There was a whole community out there. Basically, you know, the New York City community helped raise me with funds, with mentors. I was part of Children's Aid. Back then it was called Children's Aid Society. And now I'm on the board of Children's Aid. There were so many programs that helped me achieve my dreams. So now I reach back and I try and help every single program that helped me. And I think, you know, I'm very biased towards and understand those of us who've grown up in New York and understand the dynamics of New York. But I think you can see that same story from all over the country. So wherever you guys are from, you know, there's nothing that can hold you back. We're all given a hand, a set of cards. And some of us are loaded with kings and queens in that hand. Some of us have 2s and 3s, and it depends how you play that hand. You can have a bad hand and you can still win. And it's important to work hard, but you got to sort of know what you're dealing with and what you can do to help yourself achieve your dreams. And since most of you are here, are interested in medicine, part of your dreams is helping others. And I think that's a noble thing to do, because there are many professions where it's, I want to do this so I can make money and be comfortable. In medicine, you're doing it to take care of people. And you know what, as a side benefit, you end up being comfortable. So I can't think of any better field to go into than medicine. And as a thoracic surgeon, I think I've got the best of all worlds. But that's my own bias.
So what drew you to thoracic surgery? I mean, it's a long training process. So what were the steps that sort of led you to thoracic surgery as a profession?
So thoracic surgery is really 2 years after general surgery. After medical school, you have 5 years of general surgery and then 2 years of cardiothoracic. And within cardiothoracic, you've got adult cardiac, you've got thoracic, which is cancer, lung cancer, esophageal cancer, and then you have congenital, which is baby stuff. And so you usually specialize in any one of those three. And somehow for me, as I was playing my hands and studying and doing other things that I loved, thoracic surgery kept hitting me in the face. So it's not like I went a straight line. I knew all my life I wanted to be a thoracic surgeon until I hit my 4th year of general surgery. Then I realized, oh, this thing's calling me. This thing, and it was interesting. One time, a patient of mine, and this goes to show you how much you learn from your patients. I specialize in a cancer called mesothelioma that you get from asbestos exposure. And one time a patient was asking me, said, why did you choose to specialize in that? I don't just specialize in mesothelioma, but lung cancer, esophageal, et cetera. But this is the rare cancer that I specialize in. And I started explaining to her about why. And she said, oh, so you didn't choose it, it chose you. And that just sort of opened my eyes. I was like, wow, in a way, she's right, because the opportunities in front of me led me down that path. I didn't decide to go this way or this way. I just sort of went with the flow, and it worked out. And so, I think you take a little bit of both. You have to be directed and goal oriented, but don't be afraid to sort of go with the flow, make the most out of what falls off the back of that truck.
That's good advice, especially from someone who used to load the truck. You know that what falls off is important. So thoracic surgery is your specialty, and you have a fellowship in research. What kind of research are you working on right now?
So research is really the thing that distinguishes when you're in an academic institution versus private practice. Although there are some private practice people that really can do some good research, but research was something that I got interested in as I was looking for fellowships after general surgery. So, the teaching is, listen, you got to do research, you got to get papers so that you are sought after by these programs. And so I did it because I thought it was a way for me to get a good fellowship. But then I fell in love with it. And I realized there's so much research you can do that's not at on the lab. Sometimes, people associate doing research with pipetting and measuring stuff. There's so much research you can do from just looking at clinical data. So like I was explaining before we started this group, is I observe a lot of patients that live here in East Harlem. And a lot of them are exposed to fungus in their homes. And then I start seeing this in my practice, where I've had to remove half of people's lungs because they've got fungus coming out of it. And then little by little, I started to put the pieces together, and I realized most of those people are coming from public housing. So I've gone over to many of the housing complexes here in East Harlem, Carver, Wagner, Lexington, and I've gone into people's homes and I see the black fungus that is coming down in their bathroom, which gives you fungal infections, mucormycosis, aspergillomas, things like that. And it made me realize that, wow, yeah, I can operate on this and I can take this stuff out but what's more important is preventing it. And I realize that the solutions aren't always medical. We may see the problem, but we have to figure out the solution. And the solution to this is actually political, not medical. And that makes you realize that there is a very big role as an activist that many physicians can play. It's not for everybody. It's you're going to get punched in the face because there's a lot of people who lose money when you call out certain things. But it's very important. If you really care about the community out there enough to be a doctor and take care of them, then I feel you should be willing to do whatever it takes, whether it's being an activist, publishing studies. So COVID hit, we published about a dozen studies examining COVID in New York City and how the majority were in poor places and public housing, and their death rate was higher and their test rate was lower. And so there's a lot that you can contribute to society as a doctor and as someone from an underrepresented background. You have insight into stuff that you don't see in a book. And that gives you a special niche. And that gives you a way to give back and to do a lot of good. And that's why you need a diverse group of people becoming doctors. And I really realized that when I was in med school, over in the boogie down Bronx, you realize you went into your office and you saw this, little old lady, a little viejita who didn't speak any English, but you understood her culture. And it's important that you connect with people on a non-medical level. So when you go in to see a patient, the first thing you should do is not dive in to their medical background. Find out who they are. Do you have kids? What do you do for a living? What makes you get out of bed? Get a sense of who they are, so that when you see their disease, you have a big picture. Not everybody should get the same treatment, and understand what are their fears, what do they want, what are their expectations, and that's very important. Now, nothing's going to take away the fact you need to study and you need to know your stuff cold. You've got to work harder than everybody else. You need to be the first one in there on rounds and the last one out of the hospital. And you're going to be judged differently. You will. And once you understand that and you focus on the solid stuff that you need, this other stuff is what makes you from a good doctor to a great doctor. And I can see everyone on this call, if you're motivated enough, there are many people who have come before you who have done it. Back when I was training, there weren't many people who were out there, but over time, more and more have joined the ranks. And I think if this is your passion, I can't think of a better profession to go into.
Great, thank you. Along that same vein, what advice would you give to students who are looking to going into a competitive residency? How could they make their application stand out?
And that's just, you got to realize there's a big group that's applying. Medical students are gunners, right? We're used to working hard, getting the good grades, getting recognition. And then you're put in this pool where you're just another great medical student. How do you make yourself stand apart from that amorphous mass of applicants? And you do it, number one, by doing something different, whether it's writing papers or doing certain research or being active from an activist standpoint, traveling the world. You figure out what fits you best. Everyone's going to say, well, you need publications, this or that. Yeah, that helps, but that's not for everybody. What is it that fits who you are that will make you stand apart from everybody else applying? It's competitive. It's competitive. Don't just think you're going to get on it just because you're charming and this or that. That's not going to do it. They're looking for substance. You are going to take care of people, and your decisions determine life and death. That's not to be taken lightly. And so, you think about if you're on the other side and you're hiring somebody, who are you looking for?
Thank you. Do you know of any resources or research opportunities for students of color who are interested in thoracic surgery?
I'll tell you what I found the best thing, not just for thoracic surgery, but for medicine in general, are your peers. When I was going through Einstein, I had a great friend group. And I'll tell you, I relied heavily on two friends, Jose and Willie. We studied together, we did everything together. And when we'd study, we'd sort of talk about things in a way like, people thought we were crazy. We'd be like, yo, so this molecule came down and then he was going around the corner and this dude jumped that molecule, so we put it in a way that was just kind of silly, but stuck with us. And it's important to find a friend group that helps with that. And you'll see that those are the people that will figure out what may help you. Now you're going to have advisors. When I was at Einstein, actually, when I was at college, I had Nilda. Nilda was my advisor, and just having someone there that cared, asked about you. The first day I walk into her office, I had gold chains around my neck, high top sneakers, and I'm bebopping into her office, and I'm sure she looked at me like, "Oh my God, what am I dealing with here?" And little by little, I realized there's a way you have to comport yourself. I could not be on top of a patient with my chains hanging down like this. As a doctor, they want to see doctor. They don't want to know where you're coming from. They don't want to know anything. They're sick. All they want to know, can this person help me? And so it's up to you to identify on their terms, not on your terms. And that's part of medicine. That is sort of the art of medicine. How do you make them trust you so you can do what they want? Now, mentorship for you guys is important. As you're going through this, your self-esteem is going to take a hit 1,000 times. For some reason, some doctors can be extremely condescending. They can make you feel like crap. They can make you feel stupid. Why? I don't know. I don't do it, but I see it happening, and it happens a lot. And what you realize, that comes from insecurity. The secure doctors, the good ones that you're going to try and emulate, they don't do that to people, but you're going to run into it. And sometimes these people are going to be in positions of power, and you've got to learn to hold your tongue. You've got to learn. The best thing that example I found is anyone ever see the movie 42, Jackie Robinson, where he goes in the hallway, he's getting berated with racial slurs, and he goes into the hallway and he starts hitting the bat on the wall, because when he goes in public, he's got to be cool. He cannot let that out, because that's going to portray him in a different way. Because when you come from a certain background, that's just the way it is. And you're going to have to figure out how to play your hand. You got to know what the other side is thinking when you're acting a certain way. And you got to keep your goal in mind. Your goal is to become a doctor, and your goal is to become the best possible doctor you can become, and to take care of people. And so sometimes you're going to have help. You're going to have mentors. You're going to have, like I said, I think your peers are the most important. But then you have programs. The AETS just gave out a scholarship to an Einstein student, Justin Oliveira, who's actually one of my mentees as well. And there are programs out there, and you got to look for them. The post-bac programs, like the Buffalo program, stuff like that. Those are critical in helping you figure out, what you want to do and how to get there. And there's no right recipe for each person. Everyone's going to have their unique little recipe.
Thank you so much for sharing. We do have one question in the chat. How did you resolve barriers to the advocacy/activist work that you do while maintaining work-life balance?
You're going to have barriers no matter what you do. And what's important is you got to understand those barriers. How are people going to look at you? and what is in their head. You know, if your faith is the most important thing, and you have a chador on, how are they going to look at you? You got to know what is going on in their brain. And then you can be yourself in a way that allows you to not only sort of break stereotypes, because that's the first thing people have in their head when they see a person, whether you're Black or white or Asian, whether you're Muslim, Jewish, there's a stereotype. We're human, you can't help it. And so you can play into a stereotype, and you can play out of a stereotype. And I think when you're playing your hand, you can use it to your advantage. You'll see certain situations where it benefits you. And I think that, you know, the biggest thing I can say is, especially with the political atmosphere out there, there's a lot of hate being spewed around, especially on social media. In person, I have found people to be more open-minded and more loving than on all these social media outlets. So I will tell you, have faith in people. I have seen patients who are so thankful to doctors who look 100% different to them. I've had people coming in, I swear, just, you could see their politics on their body, the way they comport themselves, going to a doctor who you can tell is on the opposite end of the political spectrum, opposite end of the religious spectrum. And there becomes a trust and a bond there. And it doesn't mean that the politics are not clashing. It's that they connect on a human level. And that's what medicine allows you to do. You're connecting with people at a very human, very vulnerable level. When they see me as a doctor, they're at their most vulnerable. You know, they're ready to, you know, they're facing death. And I deal with a bunch of different people. Rainbow of colors, all religious faiths. One room, I'm talking to a billionaire. Next room, I'm talking to a homeless person. I'm operating on someone from Park Avenue. Then I'm operating on someone from 110th. You know, so there's so many different situations you're going to find yourself in. And when you know what it's like to be a second-class citizen, when you know what that feels like, that makes you a better doctor, because you realize that person in front of you needs a little extra. And when you have felt insecure, unsure, you know, it makes you a better doctor if you can get to that, past that point. So just realize that your differences here, racial, religious, everything, are your strengths, actually. You just got to know how to play it.
Wonderful, thank you. So you speak a lot about politics. So I just wanted to know, do you see yourself kind of engaging more in the political sphere at some point?
So I don't know about that. I don't know, maybe some of you know, I had a midlife crisis and I ran for mayor of New York City as an independent. I didn't run to become a politician. I ran to try and get the public housing thing on the radar. And I learned a lot of other things of how corrupt politics are and how the two parties really dictate everything. It's amazing because you couldn't get any exposure. Here I am, I'm someone that has been on Rachel Maddow, NBC, ABC, CNN, Fox. I've been on everything. You figure they'd say, all right, in the middle of COVID, let's hear what this doctor has to say. They knew exactly who I was, yet I got shut out because politically, the duopoly, the Democrat and the Republican parties, they pay advertising, and the media's bottom line relies on that. And so, unfortunately, money's the first thing that they look at, and we were running just on ideals. And like I said, we weren't expecting to win, but we were expecting to get a message out. Couldn't get that message out. So what I'm doing now is I'm trying to get this march on City Hall that we're going to probably, it's going to take, you know, probably 6 months to plan, but I'd love to get like 1 million people to say, hey, listen, we've had Democratic leadership for the past over a decade in New York City, and public housing is getting worse. All you guys ever talk about is, oh yeah, public housing, NYCHA, all this, and nothing's being done. So, I think it's time to, hold their feet to the fire, because I'm seeing the result of it in my practice. Nobody's getting better. People are getting sick. So that's something that I feel very strongly about. But the good part of this is what I do every day. That patient in front of me, the person who I'm holding their hand, that person who knows what it's like to be a second-class citizen, to get treated as a second-class citizen, and I treat them like they're a VIP. And so that is something that you guys all have the capability of doing. That's your superpower.
Great. One more quick question from me. So I see that you have a master's in biostatistics. So I was just wondering what the motivation was behind pursuing a master's in biostatistics, and if you've been able to use that in your career.
So that was something that helped me stand apart from the amorphous mass. So you also got to play the game. When I was coming back to New York, so I was in Boston for 3 years. I came running back home. My first job was at Memorial Sloan Kettering, and I was there for 10 years. In order to get that job, I needed a special niche. And the person who wanted to hire me said, listen, we've got to do something so that you have a stamp of academic medicine on you. And so I went to Columbia in my spare time, as I had 3 kids and I was starting this job. And then I got my master's degree. It was hard. It was difficult. Biostatistics is not intuitive, but it allowed me to read scientific papers and weed out the BS. I can look at a paper and say, this is BS. And that's a very big skill set to have. And I can do research looking at clinical data sets where I know ahead of time where the pitfalls are going to be, and construct these clinical trials in a way that are solid. And so, like I said, there's no one path for each one of you. You have to do what feels right for you.
So I was going to pivot and ask you a little bit more about the work that you do on a day-to-day level as a thoracic surgeon. And I know you also have an administrative component to your work, but what is it like to be a thoracic surgeon? What are the morbidities that you see? What kind of work do you do? What does your overall week to month look like as a surgeon?
So as a thoracic surgeon, I operate on a lot of lung cancer, esophageal cancer, mesothelioma, which is the cancer you get from asbestos. And I've been doing that for like 25 years. I'm also the chairman of a department here. So I've got about 11 surgeons who operate under my supervision. And that was part of the reason I left Sloan Kettering to come here. I felt like all places of New York City, not just the Upper East Side, but East Harlem, and we cover hospitals in the Bronx and Brooklyn, in Queens as well. I feel every community should have access to quality thoracic surgery. So I make sure not only do I do the surgeries that are required with care, et cetera, but that all of my partners here do the same thing. And so if they're in trouble, let's say at the Bronx VA, I'm at the Bronx VA helping them out. Let's say in Brooklyn, Queens, I'm over there helping them out. So that's basically my role as a chairman. The other thing that it allows you to do is I've seen the world. I've given lectures and I've operated in places all over the world, in China, in Mexico, in Europe, and South America. I just came back from Medellin, Colombia. I think, medicine allows you to do that. And, every time I'm operating on somebody, I think to myself, wow, they're actually letting me do this. They actually paid me to do this. And then every time I'm seeing a part of the world that I've never been to, it's like I'm that little kid playing in the fire hydrant. Like, wow, this is new. I can't believe they're letting me do this. So my eyes are always just totally blown away by the wonders of the world. And medicine will be the window that allows you to see a lot of the world.
I also just want to take a minute and pause. If anybody has a question, please go ahead and raise your hand and we can get you unmuted.
Don't be shy.
Don't be shy. There was a question. Oh, Crystal, let me. You should be able to unmute.
Thank you. Thank you so much, Dr. Flores. You're honestly very inspiring. I hope to be a doctor like you one day. And I was just curious. So would you describe your type of research, since you're able to go out into the field and conduct research instead of just staying within the hospital confines? Is that translational research?
That is more activist political stuff. The research that I do in the hospital is looking at databases, pulling up the data of the people that, let's say, have asbestos exposure, cancer, no cancer, and where they live. And I try and use statistics to find out if the association is real or is it just by chance. When I go into people's houses, that was just me. So I'm in this group called Community Voices Heard, where it's on 106th Street, and it's basically these little old women that live in public housing. These women are incredible. They've raised their families. They're there, and they're trying to make sure that the mold, the lead, the asbestos in their house is taken care of, and no one's helping them. And so when they tell me, hey, doc, I don't know if there's asbestos there, I'll go to their homes and I'll take a sample and I'll test it myself and I'll spend my own money doing it. So it's not like that's research. That's just me feeling like I'm being a doctor. As a doctor, like I said, you got to take care of patients in any way that you can. And to me, based on my experience, what I see in their chest, I don't see how I cannot go there and do that. What else? Other questions?
We actually got a question in the chat. The student asked, what is one of the struggles that you faced as an undergrad and as a medical student?
Getting the grades. I mean, I was not a genius. I had to study a lot. Like when I look at my kids now, my kids are so much smarter than I ever was. And it was so hard. I went to undergrad at NYU. I was in HEOP, Higher Education Opportunity Program, had a full ride. They paid for everything. And I felt like, wow, I've got to really get good grades. It was so hard to get an A. I always ended up with an A minus, and it was just so difficult. And what I realized I had to do was study more than the next person, get more books, meet with the teacher. Like I said, I had to double the time that other people put in. And that was just me. I think your generation has grown up with the internet and learned how to read and do all of that stuff at a younger age. Reading was my weak point. On the SATs, like I got such a low score on reading. My math was off the charts. But the reading thing, that really got me. And now I do my best to try and improve my reading. I'm actually in the middle of writing a book. And so you can overcome stuff. And hard work is basically, hard work is not always a guarantee that it's going to pay off. And you got to do your hard work, understanding that hopefully I'll get lucky as I'm working hard.
Great. I saw that. Hold on one second. Farha should be able to unmute.
Thank you. Is everyone able to hear me? Thank you. Good evening, Dr. Flores. Sorry about the background noises. I'm doing a clinical shadowing in person. So my question is about deciding to pursue being a surgeon. It sounds like you obviously contribute a lot of time to advocacy work and you seem to enjoy patient interaction, but surgeons by trade get fewer hours to interact when patients are not under anesthesia. So how did you decide to go into that field and kind of forego that vis-a-vis interaction with your patients?
That's a great question. I didn't have a choice. I had to operate. I had to be in there and I had to have my hands in there and there was no way around it. And it just, I love it. And what I realized, all the other stuff, the advocacy and stuff like that, that came second. And it still does come second. For me, it's surgery. Like today, right now, I'm operating. I'm talking to you guys on the fly as I'm in between cases. You make time for stuff that's important to you. This to me is important to me because I had people that advised me and helped me along the way. I have to do this. You know, this is very important to me. But the surgery part, that always takes precedence. Now, I did manage to be a good dad. I was home for my 3 kids. My wife is a surgeon turned stay-at-home mom. For 20 years, she didn't practice surgery. So it's difficult that's not everybody. We have surgeons here who have their kids and have worked all through it. So different people manage things differently. And I see the majority on this call are actually women. And it's difficult. It's harder for you than it is for a man. That's just the way it is. And it's important to understand that as you're going forward. The demands on my wife as a female surgeon and a mom was much more than the demands on me. Now, many of those are self-imposed by society or your family. That's hard. And you got to figure out what role that's going to play in your life. And a lot of this journey is figuring out who you are and who you want to be. And a lot of that will be determined by the actions you take. And, you know, so if surgery is that important to you, you learn how to fit everything else around surgery.
I see we have a few other questions in the chat. If anybody wants to raise their hand, we can unmute you and you can ask verbally. All right. So one of the questions was, what drew you to thoracic surgery versus general surgery?
It's all good. Thoracic, general, ortho, opto, it's all good. You just got to see what clicks with you. And you may not get there until after you're in your residency. That's okay. You may not decide. I mean, when you're in your medical school years, maybe by your 3rd or 4th year, you got to decide between surgery and medicine, but you don't have to decide what part of surgery. You've got time for that. So I think I gotta get going now, guys. Let me type my email in the chat. If you guys have any questions, please, there's no stupid question. Let me know if I can help guide you. Just send me an email. And if I don't respond, send me another email. It means I dismissed it. All right. And I wish you guys a lot of luck. And just by the fact that you're on this call, you know, says something about you. And just don't give up. Keep working hard.
Well, thank you, Dr. Flores, so much for your time. I know you're being pulled in a very important direction. So again, thank you to everybody who joined tonight. Thank you so much for joining us. We'll leave it open for a minute in case anybody wants to write down the email address, and we will follow up with a recording as soon as we're able to.
Okay, thank you
so
guys.
much.
Sorry to run.